Physical therapy is really just an opportunity to help you live the life that you were born and meant to live. We see a little bit of everything here. Post-op, so total knees, total shoulders, rotator cuff repairs, ACL repairs, aches and pains. A lot of people, but athletes in general, they just know when their body is not functioning right, and those are people that we'll see for tune-ups on occasion.
Every situation is its own unique puzzle that we have to kind of figure out.
I think there are three things that make this clinic special. There's a lot of really fun, fancy equipment that we have here at the clinic that isn't typical.
We can use this treadmill across the rehabilitation and sports performance spectrum. It has a safety harness with it, so we can do very high-speed training very safely. So we can push a person's limits.
I think it's important to me to try to create like a family atmosphere because you don't always get that outside of here. And with the stresses of daily life, that's the second factor. And the third factor, I think, is that DMU is a state-of-the-art facility in general. Being a part of DMU allows us to have a lot of resources that we wouldn't normally have.
The students challenge us to be at the top of our game, and being at the top of our game then benefits the patients as well.
Anytime you can tie technology in with a treatment session, it just makes it more fun.
Which now helps us to do a better job of objectively analyzing movement.
We've got the Biodex, which really has two main purposes. One is performance training, and the other is therapy.
We can use the DorsaV to give us information as movement experts to identify where an athlete's weaknesses might be.
We've also got a medicine ball wall. Whether you're a baseball player, a swimmer, maybe you play volleyball, we can work on developing that hip-shoulder separation pattern that's so necessary. We have a shuttle balance. We can work core, we can use upper extremity.
Dry needling is one tool that we use as physical therapists to help a person overcome pain and issues that are limiting their function and their comfort. We insert a very, very small needle into the muscle, of which creates a neurophysiological response. And that response is a response that allows that muscle to relax a little bit, to not stay so tense.
I like to describe it kind of as a warm hug sensation that you'll feel around the needle.
So the patient feels better, and then they can either stretch, or they can move, or they can sit more comfortably without that strain.
Another unique opportunity we have is the recovery zone. There are wraps that you put on your legs, your arms, and or your hips. They have 5 chambers, and they inflate one chamber at a time and then deflate. That increases blood flow and circulation to the body to help push out lactic acid. So it makes you feel good and helps you recover faster from your workouts. I think the most rewarding part of all that is that I have the opportunity to really get to know somebody.
It is absolutely rewarding to see a patient make progress.
I see them at their lowest, and then I get to see them at their best. I get to see them when they're picking up their kids, or when they're playing with their grandkids, making a hockey shot on their ice arena, spiking the volleyball, playing the football game.
That's why we do what we do, and why we enjoy doing what we do, and why I've continued to enjoy doing this for 20 plus years.